Music from Essence of Worship, Umetenda, song to remind us that the Lord has done it and we have a reason to thank Him, to praise Him, and to honor Him. Having brought us this far, counting those blessings, naming them one by one, it's truly the Lord's doing and it is marvelous in our sight. Coming up to 20 minutes to 8 o'clock, you're listening to Breath of Heaven on Hope FM, Listen and Live, and every last Thursday of the month we usually have a conversation revolving around the health of our bones, and we have our partners, that is AICQ International from Kijabe, who usually send us a doctor. And tonight I have the honor and privilege of having three doctors, and it's going to be interesting. And all of them are orthopedic surgeons, pediatric orthopedic surgeons. I have Dr. Federico Sibona, who will also introduce us to the doctors that have come to visit with us. And so, karibu sana.
Thank you so much.
Yes.
So tonight I have the honor to have the two guests that came this week. We had a focus this week at Cure on cerebral palsy children that we take care on a daily basis. So it was a wonderful week with Professor Federico Canavese, that is an Italian colleague that has been working in France for a long time. He's an expert in cerebral palsy and spine surgery. And Dr. Francesco Candusso, that is my colleague, a pediatric orthopedic surgeon that we work together back home in Italy. And after almost 4 years, we just had this wonderful opportunity to work together at Cure. So it's wonderful to see friends working together with them for the cause of children that need help at Cure.
Mm-hmm. So we'll get to hear their voices, and they'll tell us how they've found Kenya. If it's your first time to be in Kenya, tell us.
So good evening, I'm Federico. I'm very happy to be here, and of course I enjoy my week here so much. But it's not the first time in Kenya, because I was in Kenya maybe 20 years ago for the first time with my family. Because my father at that time was working in Somali, so a nearby country. So because we were living in Mogadishu at that time, we had the opportunity to travel a couple of times to Kenya. But it's been so long, so it has been a pleasure for me to rediscover the country, beautiful country. Thank you.
Thank you very much. Good evening. I'm Francesco. I'm from Russia, and I was colleague of Federico, and it's my first time in Kenya, and so I'm very happy and very pleasure to be here. Thank you very much.
And so tonight, as we have these wonderful doctors with me in studio, we have a conversation that is revolving around trauma and accidents. And I know this is what they deal with on a daily basis, probably time and time again, when somebody presents to them with traumatic injuries that came about as a result of an accident and all that. And so we'll be talking about that. And if you have a question or a comment, you're welcome to send it here, and the SMS line is 20933 or WhatsApp on 0717400555. And so in starting, we'll just want to give ourselves an opportunity to understand some of the most common types of what you would call orthopedic injuries resulting from trauma or accidents. You could share with us so that somebody can get a better understanding of that, Dr. Federico.
So the first thing that I would say is the most important thing in accident is prevention. So road safety is the first thing to push for every country, not just Kenya, but also in Italy, in Europe, everywhere. The other thing is that for us that we deal with children, most of the times the result of a bad accident is also that children are without the the proper safety measures, like children's seat and seat belt. So that's an important thing. Sometimes you hear people saying that Kenyan children are stronger because they can just hold on the seat, but there's nothing like that, because when the accident happens, the best that you can do to save your child, and it doesn't matter if you have to do 50 meters or 100 kilometers, the best way is to make it as an habit. Okay, so wear the seatbelt to avoid worse injuries during any travel that you do, and observe, of course, the speed limits. So the most common fractures that we see around are lower extremity fractures, especially tibia, which is the shin bone, and femur, which is the thigh bone, and also in children it's less frequent because it must be a trauma with high speed, like dashboard injury. You can have dislocations of the joint, though this is less frequent in our context, not unless it's a multiple injury. The other thing that we should say on children is that the difference between children and adults is the children, they compensate a lot in terms of also bleeding, and then they crash. While the adults, they slowly decline and then get worse. The children are kind of doing good up to a certain level, and then they crash. So whatever or whenever people have an accident, they, even if the child is well, it's good, especially if the speed was high, to take them to the hospital facility, just to do a checkup of what was happening, blood test and ultrasound of the abdomen, or few x-rays in case there's pain, to avoid the child to crash and die, just because of seeing the child in a fairly good condition after the accident. So and also the other thing that I would say, just this week there was a kid that was rolled over a truck because he was holding onto the bus. It seems an innocent game, the children do that because they want to have fun and jump on a lorry, jump on a truck, but it can be really catastrophic, and this can lead to spinal injuries and get the children bonded to a wheelchair or even die. So also these things as a parent are really difficult to even as a doctor to talk to the family, to explain the situation, and it's just a second that can change the life of these children. So also as parents, we should avoid or try to prevent this situation so that these children will have less of these lesions, but especially for the ones that are living in Nairobi. For us living in Kijabe, it's there's not much traffic, there's a lot of bumps in the road, so the cars are really going very slowly. We never had a road traffic accident, but especially in Nairobi, especially where there's no sideways, it's very easy for the kids that are just playful and they want to spend some time and have fun, to get an accident or to bump into a car and have fracture, especially of the lower extremities. Yeah, and also the other thing that I would say, never try to underestimate the damage that can happen when you travel on a motorbike. Make sure always that the driver is fine, because if you overspeed in the road, you can have really bad injuries of upper extremities and lower extremities. And once you have an injury, that can be, threatening your life. So it's pretty frequent. I think right now the government has done a good job in trying to emphasize how much is important the road safety, and also trying to be as much as possible careful if you can't take a car or a bus to go on a motorbike in a big road, because of course that can be really dangerous for children, also because they are not having the same attention as an adult when they go on a road. Yeah.
Any addition from Dr. Federico?
So just a couple of addition. Federico said almost everything, but I think it's important to make a distinction whether you are the passenger or you are the pedestrian. So this makes a difference, because what you have to keep in mind is that the anatomy of a child is not the same as the one of an adult. Particularly children have a higher weight at the level of their head, which can have a significant repercussion when there is a traumatic accident. In particular, when a car hit a child, they tend to have always three kind of lesion. They are hit at the level of the lower extremity by the front of the car. Then they are projected on the front part of the car, which they hit with their chest, and then their head finally hits the window of the car. So these children usually, when they are run over by a car, they tend to have multiple injuries. But the other point I would like to, and so this situation should not underestimated. And the other point that is important is that because of the same reason, even if these children, particularly very young children, wear a seat belt, they can have an injury because of the head of their head. And this is particularly important at the level of the spine, where they can have flexion extension type of injuries related to the belt that is blocking the chest. And this lesion carry a particular name, which is called the Sivora lesion, which means spinal cord injury without radiographic abnormalities. So some of these children may join or may get to the emergency department. You take an X-ray and you cannot make a true diagnosis of a vertebral fracture, but they have a spinal cord damage which may be permanent. So there are a lot of specificities of pediatric road traffic accident that have to be taken into account by the doctors dealing with these children. And the other point is that this injury should be prevented first rather than be treated. And so it is important to have these prevention strategies not only in cars, motorcycles, but also outside schools, because you don't have to forget that many of these accidents occur outside the schools. Because lesson ends, all children run outside the school, and then a car runs by and hits the children. So prevention strategies should not only focus on the child, but also on the environment of the child, particularly the school, the playground, and where they go to do sports activities. So it's really a 100% prevention strategy that is really important. And it has been shown in many settings, whatever the country, if you apply prevention strategies, and these are well applied, the number of injuries related to cars and to children goes down. So prevention, as it has been said before, is really number one. And then number two is the specificity of the lesion children can have following a trauma that has to be taken into account, of course.
Yeah, I also want to bring in Dr. Francesco. I got it right. So,
you're right.
apart from the road accidents that happen in school environment, there's also the home situation where children can also injure themselves. And probably you can share with us some of the areas that are very, very prone, especially at home, when children are at that point where they find themselves having those injuries. Some of those injuries that happen at home.
Yes, of course. As my colleague explained, the prevention is the better things to do to prevent the injury. And also at home we have a lot of kind of injury that are more dramatic for the children. So jump from the chair or on the sofa or sweep on the and so this is important to prevent. And I don't know another. Okay.
Yes.
Thank you.
There are many injuries that can occur at home, and you should differentiate between two big categories. The first one are the classic traumatic injuries. So whichever fracture can happen in children, you can have it in a home setting. It's just a fall, you can break your arm, you can break your leg. But then you have all the issues that are related to burn injuries. And so this is particularly frequent in very young children. So burn injuries can be very dramatic because when the burn is deep and has destroyed the soft tissue, it can lead in some cases to amputation, or when the burn is so extensive, it can lead to death as well. So regarding the classic traumatic injury, if we exclude the burn injuries, most of the lesion occurring at home involve the upper extremity. 3/4 of the injuries at home belongs to the upper extremity and 1/3 to the lower extremity. And this same percentage is seen even in outdoor setting. So when you refer to classic fracture, you exclude traffic road accident, you exclude burns. Upper extremity is always involved 3 times more than the lower extremity. And within the upper extremity, most common lesions in order of frequency are wrist, elbow, and hand.
We'll carry on with this conversation even in the next hour. In case you are joining us right now, we are having a conversation on trauma and accidents. And yes, we have 3 doctors in studio. You can't believe it. So you have any question, you have any comment, you are free to send it to us here. Our SMS line is 20933, or you could WhatsApp on 0717.
Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Initiative of Hope Media. Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer. Did you know the Friends of Hope is an initiative?
You, the listener, are the reason why we go on air. You, the friend of hope, are the reason why hope is alive. You have helped us take hope across the country and to the rest of the world. Through your giving, we have been on air for 18 years and witnessed many people coming to the Lord. Through your giving, we have expanded our reach to 3 new regions, namely Kisii, Nyeri, and Meru. Through your giving, we have expanded our reach to an international audience through DSTV and GoTV platforms. Thank you for your sacrifice and generosity toward this great initiative. As we continue spreading hope to the other unreached regions in Kenya, you are invited to be part of the Friends of Hope through a contribution of any amount via M-Pesa paybill 933933, account name FOH. Friends of Hope, keeping hope alive. God bless you. You, the listener, are the reason why we go on air. You, the friend of hope, are the reason why hope is alive. You have helped us take hope across the country and to the rest of the world. Through your giving, we have been on air for 18 years and witnessed many people coming to the Lord. Through your giving, we have expanded our reach to 3 new regions, namely Kisii, Nyeri, and Meru. Through your giving, we have expanded our reach to an international audience through DSTV and GoTV platforms. Thank you for your sacrifice and generosity toward this great initiative. As we continue spreading hope to the other unreached regions in Kenya, you are invited to be part of the Friends of Hope through a contribution of any amount via M-Pesa paybill 933933, account name FOH. Friends of Hope, keeping hope alive. God bless you.
Revolving around trauma and accidents. Tonight, I have the honor and privilege of hosting 3 doctors, and it's a wonderful thing to get these insights, especially when it comes to accidents and the injury that come with it, and how to deal with the same. And as we've had in the previous hour, the clarion call was looking for preventative ways, prevention, even to ensure that if it's children and even adults, do not go to the extent of getting those injuries. And so you have an opportunity to also send your question or your comment to 20933, WhatsApp on 0717400555. As we have had a conversation, I know it's important for us to also look then at the treatment options, because after all has been said and done, there is this case that has been presented to you at the clinic or at the hospital, and you would tell us then the typical treatment options for orthopedic injuries caused by accidents. What are some of them?
So it depends what we are dealing. So most of the upper extremities fractures that we see, especially the forearm or the wrist, most of the time can be treated by casting. But what is most important is that most of these fractures need a checkup or an X-ray between 1 or 2 weeks, just to make sure that the fracture does not move in the cast, and it keeps the good alignment. Because what we see at cure the most is the complications caused by inappropriate treatment. And I know that most of the time the families, of course, are putting their trust in us as doctors, but as a hospital, I think every hospital should give at least on a soft copy, if not on a hard copy, the X-ray of the child that had the trauma. Why? Because this can be seen by other colleagues to make sure that we are doing the appropriate treatment. It's not because we are cure. I think the best would be to be sure also in between us as doctors to have the same opinion on the treatment, and never underestimate the possibility of the displacement of a fracture. This is especially for wrist and forearm fracture, and also for humerus, the arm fractures. Those most of the time can be treated, what we say, conservatively, without the need of surgery. While the fractures around the elbow, they have a higher chance of going to surgery. What we see a lot is what is called gunstock deformity, which means that after a fracture of the elbow that was treating most of the time in a cast, but they needed surgery, they undergo into misalignment or malalignment, and then they have a deformity. So we need to do a corrective surgery because of what was not done before. For lower extremities, it depends on the age of the child also. The smaller the child, the higher the chance to treat it without surgery, so with plaster or cast, whatever you want to call it. And but in the lower extremities, especially the leg in older children, the acceptance of deformity is much less because is less accepted by the tibia, by the shin bone, and also depends on the age of the child. So there are specific fractures, but it depends also if it was a trauma with multiple fracture, then it's most of the time you have to treat to stabilize all the fractures surgically. While if it's a single fracture in a lower energy trauma, then you can treat it in a cast if the deformity allows, or if the type of fracture can allow. So the treatment for these fractures are mainly two types: casting and surgery. So those are the two types of but of course, when you do surgery, usually you check up the patient after 4 weeks or 5 weeks. It depends on which bone that you fracture. But every time you put it on a cast, not unless it's a very stable fracture. You always need to do some checkups of x-rays within 1 or 2 weeks to check that the fracture is not moving and does not change the alignment. And that is where we get mostly the complication, because sometimes we see the children at 6 weeks. And this is too late to change the cast or to align. Now you need an operation because the bone is already remodeled in a bad way. And so it's harder to get it go well without the need of a surgery. So if I could say something, if you have a fracture, especially upper extremities, sometimes it needs to be done a checkup within 1 or 2 weeks. Make sure you have the x-ray so that the child does not have to repeat the x-ray if he goes somewhere else, so that we can give our opinion and treat the child accordingly and in a good way. Yeah.
I also want to find out then what are the key steps of in the rehabilitation process after the orthopedic surgery for trauma or accidents, because you've already mentioned there are some steps that can be taken when it comes to treating, and it depends whether on the severity of that particular injury. So I'd like to find out what are the key steps then in rehabilitation process after orthopedic surgery for trauma or accidents. Dr. Federico, you have some comments on that?
Yes. I just want to make a point for the people that are listening to this talk, is that you don't have to consider the child as a small adult, because children are different. So also concerning the rehabilitation following treatment of a fracture, the approach to children is different from the one you would have for adults. I mean, most of the time, even after a period of immobilization in a cast, with or without surgery, children don't need rehabilitation. They don't need active rehabilitation. They can do rehabilitation by their own. Because if they do too much rehabilitation, this may be against them. Because doing too much rehab over a fractured bone can create some small bleeding, which may eventually evolve into what is called heterotopic ossification, which means production of extra bone, more than the bone needed to heal the fracture, which may limit then the range of movement of a particular joint. So usually children requiring rehabilitation following surgery, following a fracture, are limited. Of course, you prescribe rehabilitation only when the recovery time is getting too long, but it's not a first choice. So this is a specificity of children. On the other hand, when you have an adult that has been immobilized for a while in a cast, he or she needs rehabilitation to recover function. But the child, because they are young, they have more healthy and elastic tissues, they can recover most of the time by themselves. So this is the key point concerning rehabilitation in children following trauma. And if I can just have a couple of words to add a few information to what just Federico said, is that you have both treatment options, but you can have different type of fracture. And one specific fracture children have is what is called a growth plate injury. The growth plate is the part of the bone where growth comes. So from this area are the most vulnerable areas in the child's bone. And if the fracture injured those areas, then growth may not happen in a proper way. So for this reason, there are some growth plate injuries that occurs closer to areas where the growth is more important. That if they get damaged, they can have worse repercussion on the future growth. But also, on the other hand, children have a specificity which is called the remodeling potential, which means you have a fracture, the bone heals a little bit crooked, but thanks to the remaining growth, is strengthened by itself. So this is another specificity, and this is the reason why very often orthopedic treatment, even if the reduction of a given fracture is not perfect, it is still acceptable because of the remaining growth, which can correct the bone by itself. And of course, the closer the fracture is to this, let's say, growing part of the bone, the higher is the remodeling potential. And the same, the younger is the child, the higher is the remodeling potential. So all these factors have to be put together to offer a proper treatment to children with an orthopedic injury. So I think it's a really huge chapter of orthopedics, but because children, as I said at the beginning, are not small adults, they need to be treated by specialists in order to get the optimal outcome.
All right. And I also want to find out from Dr. Federico now. In your practice, you might have had an experience where a child or even an adult came to you and you gave them the treatment. Could you share with us some success story regarding how it was and yeah, especially that part, the success story when they presented to you with the trauma or the accident injuries there, and later on you went with them through the whole process and ultimately it was a success story.
So this year we got a child that eventually came from another facility. He had a both bone forearm fracture, but after they removed the first cast, they realized that the bones were not aligned. So they proposed the surgery, but the parents could not afford the surgery, so they came to us. So fortunately, the bone was still having this remodeling potential, as we were discussing before, and so we put it a bit of traction, which means like pulling the bone to make it straighter. And so we could correct, because of the residual plasticity, we could correct the alignment of both bone forearm fracture and put it on a cast, and then the child eventually got through it 4 more weeks of cast, and then it went well. Another child was operated, but after 6 weeks after surgery he fell. So he broke again his arm, but again we could treat him on a cast, realign the fracture without reoperating the child, and finally after more than a year the child is doing very well. The fracture is still well. He's going currently to school. So it has been really a blessing to see these children came to us with a deformity, and being able, especially I'm very happy when we avoid surgery, because it's a trauma for the whole family. You don't know your kid how he can react to anesthetics, so when you're doing the plaster, the parents are there with you. They're seeing the process. They comfort their children. So I think those were one of the 2 successful stories of trauma that we had recently. Another child with an elbow fracture that came. We had to operate on him, and after 4 weeks we removed the cast. It was fine, and now the child is playful. So I'm happy when we see these children coming out, and especially after 2 to 3 months, going back to sports, playing with the other children, and the burden of stress that the parents are going through whenever you have this kind of trauma is a lot. So we are really thankful for even for the parents that are coming to us to put their trust, because it's a relation between the child, the doctor, the family, especially if you treat them without the operation, because you have to see them, especially at the beginning, on a weekly basis, so you get to know a bit of them, you get to talk to the father and the mother, and then because sometimes, because of this remodeling potential, when they see that the fracture is not perfect, they're worried, and then you have to explain why. So it's all based on a relation. Or trust. Yes, that's what happens, and that's where the doctor comes. We are not just correcting X-rays, but we are having a relations with families. That's what I like the most, and if the patients come back to you, and because of the trust, and they tell you their doubts, and you tell them the situation is fine, it's gonna do well, and never lie to the family, make them be trusting in you, as long as you know what you're doing. So that's why what Professor Federico was saying, we need super specialists like us at Cure. We just do children, because already the children topic is so vast that it's hard to know a lot on it. So if you do adults, children, or whatever, it's very hard, because, as he was saying, children are not little adults. It's a different chapter with different lesions, different fractures, different treatment. So even the experts sometimes are tackling a difficult case. So you can imagine someone that is dealing with adults and treating the same. It's totally different thing. So, but I think Kenya is doing very well. More and more people are being trained. We are getting residents from Eldoret, from Nairobi, from Nakuru recently. So those people that pass through Cure will end up knowing what they don't have to do, and what they are supposed to do, what is allowed to be done by a general orthopedic surgeon, and what needs to be done by a pediatric orthopedic surgeon for the children that we treat to be to be treated well.
All right. We'll continue with this conversation in a little while, and also look at your questions. Keep sending them to 20933, WhatsApp on 0717 400 555 as we get deeper into this subject of conversation.
Welcome to the world of Hope Media, a media unit of Christ is the Answer Ministries that is committed to spreading the gospel of our Lord Jesus Christ through the transformative power of media. Hope Media is dedicated to utilizing various forms of media to spread the message of hope, love, and redemption to all people around the world. Hope Media consists of various units that work together to achieve this goal. These units include Hope FM. Hope FM is your #1 Christian radio station, offering you discussions on current day-to-day issues, inspiring music, life-changing sermons, and news updates, broadcasting 80% in English and 20% in Swahili, with listenership of over 12 million every month. Hope TV. Hope TV programming is designed to inspire, educate, and challenge the viewer with wholesome content to reach various demographic groups: children, youth, and adults, both male and female, with viewership of over 24 million every month. Hope Recording Studios. Hope Recording Studios is a state-of-the-art recording facility that offers high-quality recording, mixing, and mastering services. It is designed to meet the needs of musicians, artists, and other creative professionals who require top-notch recording facilities. Hope Creative. At Hope Creatives, we believe that inspiring graphic design work doesn't just happen. It takes the right people with wild, out-of-the-box ideas committed to the same ideals, working together to make it happen. We listen, we learn, we brand. Hope Digital. Hope Digital is a creative digital unit within Hope Media. We are driven by a passion to creatively express ourselves while influencing you with the same creative energy in online spaces and beyond. At Hope Media, we believe that media can be a powerful tool for spreading the message of hope as well as grow your business through advertisements, and we do this with excellence. For more information regarding our services, please visit www.hopemediakenya.org or call us on 0709 861 180. Hope Media, we keep hope alive. Welcome to the world of Hope Media, a media unit of Christ is the Answer Ministries that is committed to spreading the gospel of our Lord Jesus Christ through the transformative power of media. Hope Media is dedicated to utilizing various forms of media to spread the message of hope, love, and redemption to all people around the world. Hope Media consists of various units that work together to achieve this goal. These units include Hope FM. Hope FM is your #1 Christian radio station offering you discussions on current day-to-day issues, inspiring music, life-changing sermons, and news updates, broadcasting 80% in English and 20% in Swahili, with listenership of over 12 million every month. Hope TV. Hope TV programming is designed to inspire, educate, and challenge the viewer with wholesome content to reach various demographic groups, children, youth, and adults, both male and female, with viewership of over 24 million every month. Hope Recording Studios. Hope Recording Studios is a state-of-the-art recording facility that offers high-quality recording, mixing, and mastering services. It is designed to meet the needs of musicians, artists, and other creative professionals who require top-notch recording facilities. Hope Creative. At Hope Creatives, we believe that inspiring graphic design work doesn't just happen. It takes the right people with wild out-of-the-box ideas committed to the same ideals, working together to make it happen. We listen, we learn, we brand. Hope Digital. Hope Digital is a creative digital unit within Hope Media. We are driven by a passion to creatively express ourselves while influencing you with the same creative energy in online spaces and beyond. At Hope Media, we believe that media can be a powerful tool for spreading the message of hope as well as grow your business through advertisements, and we do this with excellence. For more information regarding our services, please visit www.hopemediakenya.org or call us on 0709 861 180. Hope Media, we keep hope alive. Welcome to the world of Hope Media.
Did you know the Friends of Hope is an initiative of Hope Media? Through this initiative, we are able to partner with others who are keen to ensure that we keep hope alive. Through your support, we are sharing the hope we have with many others who are yet to embrace hope. You too can become a part of this initiative today. Send your contribution of any amount to M-Pesa paybill number 933933. Account name Friends of Hope. For more information regarding Friends of Hope, please email friendsofhope@hopefm.org or SMS FOH to 20933. Join Friends of Hope today. Friends of Hope, keeping hope alive. Another quality service from Christ is the answer.
Revolving around accidents and trauma, and we'll look at some of the questions that are coming through on 20933, WhatsApp 0717 400 555. Let's start with this one here, and this one is saying, I have a problem with my spine. I'm experiencing pain all through. How can I contact the doctors, please? Maybe Dr. Federico would like to help this one.
Yeah. What she can do or he can do is first cure deals with children. So especially with congenital conditions or acquired condition, but up to 18 years old. and we have a spine clinic on Fridays in Kijabe. And sometimes we have it also on our branch in Nairobi Westlands, always on Fridays, on specific dates, of which if she Googles Cure International, she can get both numbers of Cure Nairobi and Cure Kijabe to have an appointment with us. But if she's more than 18 years old, then Kijabe Hospital is dealing also with back pain, and then it depends on where the person is, because there are few spine specialists in Nairobi. One is Dr. Fazal that is working here in Nairobi, and then he's a spine surgeon. Then in Kijabe, for Cure is Dr. Teuri, which is our medical director, that is an expert in spine. Then in Kijabe Hospital, who's responsible for spine pain in case she's more than 18, is Dr. Maurice Kitua. There's another doctor called Isaac Ingori that now is doing a fellowship in Canada, and hopefully will be back after July. So what we emphasize on these cases, it's depends first on the weight of the patient, because every time I say that, it's like if you have a car and you overload the shocks with weight, like those probox that you see along the way transporting everything, the shocks won't last much. So even our back has discs that are kind of shock absorbers. So if you overload them, if you're overweight or obese, of course that will lead sooner or later to back pain, and you need daily exercise for the back to be in a good shape, in good health, and especially most of the time we don't realize that we are assuming bad postures at work, especially who's sitting for a long time, because in that on the long run will get troubles, and then it depends also if someone was affected before of any back issues, if for example the patient is affected or of bad or quite a big curve or scoliosis, and was never seen by an orthopedic surgeon, that could be also a cause of not necessarily pain, but I would say also aesthetic appearance that the patient is not accepting, and or overload, depends also on the work that the person is doing. So the treatment are different, and it depends also if the pain is just on the back or if it radiates to the legs. If the patient has done any workup, like a plain film or an X-ray, or further workup like MRI. But before doing everything, it should be seen by an orthopedic surgeon, a specialist in spine especially, to see what's wrong and if there's something that he or she can do to avoid this chronic pain.
Okay, thank you. I see Professor Federico is also desiring to give a point.
Yeah, just to complete what has just been said, I think what is important, because here we are talking about back pain, but again, you have to differentiate between back pain in adults and back pain in children. Because back pain is a symptom. So people tells you about this symptom, but it's very common or quite common that an adult person tells you, I have back pain. On the other hand, there are very few children that are complaining of true back pain. And the other big difference that has to be taken into account, that when an adult is referring of back pain, there is a correlation or almost a correlation between the gravity of back pain and, let's say, the severity of the underlying disease. However, this relationship is not existing in children. When you have a child that is complaining of back pain, he may have something very severe or nothing at all. There is no correlation between back pain and the gravity of the potential underlying disease. So this is something that has to be taken into account when you deal, particularly with children, with the back pain, because you may not rule out something that is severe, or on the other hand, do too much investigation for nothing. So really, back pain is a huge problem, very subjective, because I may tell you I have back pain, but I have nothing. Someone else may have something worse. They say, I don't feel anything in my back. So, but it is important again that when you have someone in your family suffering of back pain, you have to orientate yourself towards a spine surgeon if you are an adult, or a pediatric orthopedic surgeon if you have a child that is suffering of back pain, because each one of these professionals will guide you through this issue in the best possible way, of course.
And I've seen two ladies who have also asked questions. I'll look at these two at in one portion, where one is saying they're receiving, they say, first of all, what's the cause of back pain whenever we're about to receive our monthly periods? And then secondly, ask the doctor why I have back pain after giving birth. Yeah.
So we can, I start from the second one?
Yes.
So back pain is normal or usually decrease during pregnancy, because very often during pregnancy there is a hormonal change. And with this hormonal change, due to the hormones that have changed, back pain symptoms tend to resolve. And we see this in a lot of mothers expecting their child, and they have spinal deformity, adult spinal deformity. So during the pregnancy time, they feel much better. They don't have pain in their back because of the hormonal change. But when you deliver birth, of course, your hormones, let's say, they go back to where they were. And so you start feeling back pain again. And then, of course, this situation may be accentuated if during the pregnancy you put on too much weight. Because then, if you become overweight, you increase the risk of having back pain, Concerning the second question, so it's quite normal to feel better during pregnancy and feeling back pain after giving birth. The second issue about periods, this is related to each women, because periods time are not the same, vary a lot between women, and the symptoms may vary a lot among women. So this lady may have periods that are painful, and they manifest with the back pain rather than pain more on the anterior part of the abdomen. But this is because it belongs to her body constitution, let's say, the way she is. So usually this form of back pain, if she's not overweight, if she's an active person, tend to resolve after the first 2 to 3 days of periods, and can respond to anti-inflammatory or analgesic drugs. So this is something that is just related to a limited period of time. But if those back pain is really disabling for the lady, there are hormonal therapies that can be taken to decrease the pain from periods, because you change the hormonal. And really back pain in females in some periods of time is related to the hormonal change as well. So it's not all of this, but because, as we said before, back pain is such a huge chapter of orthopedics, it may be related to some of the conditions we have just been discussing.
All right. And so in just a little while, we'll look at another question. There's one who is appreciating the conversation we are having. Her name is Helen Mary, saying, I'm a certified palliative caregiver and I want to appreciate the knowledge sharing from today's guests. And one more here, I think, this one is from a lady who says, I was involved in a road accident twice in the year 2017. I have been having a phobia of traveling at night. This month I traveled at night, but I was awake for 13 hours throughout the journey. I have never been to a counseling session. Am I okay?
So I think personally, I was involved in 2021 to road traffic accident in Kenya. Actually, I was hit by a school bus, so I can understand that, especially because it was a sudden head-on collision, and the bus was full of children. So it just went into my lane on the opposite side, so I couldn't even see the bus because it hit the car in front and then went into my carriage, and so it was a head-on collision. And sometimes when I close my eyes, I still hear those children screaming. So I can get your point. But I think every experience should be a new birth. And what I asked myself, it was like, I just broke my ribs and nothing else was. I didn't need any surgery, and despite the psychological issue of traveling, it takes some time. But I think if you look at all the people that you have around, you should really rely on your friends and whoever stays close to you. And I mean, Cure as a Christian organization, we have pastors that they're not only preaching, they are doing much more to every patient and to every parent. Counseling is very important. So even myself, I went through it. You just have to see and go towards this black spot that you don't want to go really into depth, and that's where the problem is. And if you are able to get to see a counselor or a pastor that you trust, that is able to counsel you, to go into this dark side of your heart, this thing that is still hurting you into your soul, will be a rebirth, and will help even other people to recover from a post-traumatic disorder that can happen. I can understand you. I can get you. But right now it's 7 years. You should go for it. Go for it. Don't be afraid. It's not a disease. You are pretty much normal. You just need counseling, and believe me, there are a lot of good counselors here, and it has also helped me after the accident to be back on the road, do what I like, treat children, and being really positive in life. By the way, tonight we are traveling back home to Kijabe, and I'm not afraid because you have to get out of this situation, but you have to go into depth of your soul, being counseled, and believe me, all is gonna be well.
All right. Thank you. I have another question here as we continue. This one is from a listener who says, just had a plate implant on my left shoulder. That's on Monday. So far, I am good. So let's say 4 days ago. Any advice you would do me good? And is it advisable to take it off when I heal? Maybe Professor, I'd like to have a word for this listener.
So It depends. Of course, first you have a plate. So probably this lady had a fracture. Of course, the plate is there to stabilize the bone while it's healing. Once the bone has healed, the plate is no longer necessary, of course. So it can be taken out. But taking out a plate is another surgery. So this is something she has to think about. If she wants to go through, again, another surgery, another anesthesia, another surgery, another period, which will be shorter of recovery. And then leaving the plate in or taking the plate out. If we assume that the plate is not impinging, is not creating any mechanical pain, I would say, it's not because you have the plate in or you have removed it that post-fractural pain will disappear. Because every time you have a fracture, there is like a scar into the bone. You don't see it on X-rays, but it's like a memory scar into the bone. So when the weather changes, when humidity comes in, when you change from hot to cold weather, you may start having some pain where the fracture was. And this kind of sensation is not related to the presence of the hardware. So according to her age, according to the type of fracture, according to her comorbidities, which means the disease, other diseases she may have, she can decide once the fracture is healed whether to remove or not the plate. It's not an obligation. If the plate is not impinging, is not creating any mechanical issue, to remove it.
And so we will be concluding it at that. But I would like to hear from you, probably your concluding thoughts, what you wanted to share, especially in the first subject that we had, and then any other subject that you'd like to share about trauma and accidents. Any word that you'd like to share with us as your parting shot, Dr. Federico?
I think we spoke a lot, and I thank you, Federico and Francesco, especially to share some statistics and also about taking care of our pupils outside the school. This was, I think, a very important point. Even today, as we were coming here, we saw a lot of children just running outside the schools, and I think not everywhere the school there are proper signposts or proper bumps to avoid people overspeeding and hitting children. So again, I think that's one thing that it can be improved for us to take care of our future, our children, and making them safer against odds, against accidents and events that they are not thinking about because they are just all together, they are so happy, they just run outside. So if us as adults, we can put signposts and bumps for the drivers to avoid overspeeding, that will help the children to have less injuries and keep being happy inside and outside the schools. Yeah.
For you, Prof?
So thank you. I think it was an interesting talk.
Yes.
But I would like to tell families and to tell parents, if they take a motorcycle, children have to wear helmets. If they take a car, they have to wear seatbelt. If they go out to school, they have to look around before crossing the road. So again, simple prevention measures can avoid dramatic injuries. And this simple action is a life-saving action. So this is what they should keep in mind. They have to protect their child by simple measure to avoid them to be treated for a fracture or for a much more serious injury. So this is my key message, and I really would like to thank Cure and Hope FM Listening Live for hosting us. Thank you very much.
All right. Any parting shot? You've been listening. You've been listening. Yeah.
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 Thank you very much for everything, for Hope FM and Federico, Professor Ferranavesa, and everything. So thank you very much.
All right. You're welcome. All right, that's just about it. In case somebody would like to contact SCQR, you'd like to give them the contacts or tell them how they can reach you.
So the easiest thing I can show you live is to dial the numbers that you can see. Like I'm just typing in right now. If you type Cure International Kenya, so it comes out with in Google with the phone number 0733 770 653. I repeat, 0733 770 653. So that's our number for Kijabe. If you have to ask questions about what we do, or if you want to contact us, if you want to ask, we have clinic every day. The main day of general clinic is Wednesday in Kijabe. So you can contact the Cure reception, and they will further explain you how to get in touch with us, when to come. Yeah, thank you so much.
It's been great hosting all of you, and I'm learning great insights. And I wish you all the very best as you continue with your practice. May God be with you.
Thank you. Thank you so much.
Welcome. Welcome. All right. In the next hour, we have From the Scriptures, reflections and our prayer time here on Breath of Heaven.
This is Breath of Heaven on Hope FM.